was late February where myself and President Rowe were having a phone conversation, and she said, this COVID-19 is really a threat. What are we doing to prepare? And for me, that was sort of the kickoff moment of we need to assemble a regional team, talk about this, and just expand it forward. What happens if? Fully expecting never to cross that threshold, and only to realize that, in fact, we were going to cross it, and pretty quick, with the first case in Virginia in late March.
When the greater Williamsburg area started experiencing some cases of COVID-19, it was important for us to get ahead of it to the extent that we could. The fire chiefs of the entire peninsula had a number of conference calls to try to come up with a process to start dealing with this and assist the health department. We collectively, with the support from our city and county administrators, developed what was known as a Peninsula COVID Operations Center. That was based initially out of the Emergency Operations Center in Newport News, and that's how we managed dealing with all aspects of the pandemic early on.
Well, it is a very long-term disaster with, I like to kind of think of it as mini disasters in between. So at first it was, oh my gosh, we have this thing, we have to get more PPE for our fire, police, and other frontline workers. And then we moved on to how are we going to get people vaccinated once we do get a vaccine. There was the handing out of masks and hand sanitizer as well. Also working with community partners again to make sure that those that were homebound or had lost their job recently were able to access food.
When the pandemic happened, we very quickly hit between 500 and 700 families consistently every single week. So for us to go from 100 bags of groceries going out the door to serving 700 families was just incredible. We were really blessed when some of the restaurants that weren't able to open, they shared what they had in their freezers and in their cold storage. Busch Gardens did it. They shared what they had with Grove Christian Outreach. Grove shared with us, and then we would do the same. So we really did a lot of that coordinating of the resources and making sure that we were covering all of the areas of the community.
Schools shut down, and for the Grove community, that's a huge deal to us because so many of the families that live in Grove are food insecure, financially insecure, and the meals that they got when they were in school are the most important meals they get during the day. We were very fortunate to get an amazing grant from the Rotarians, and that allowed us to purchase meals every day from local restaurants, which in turn helped the local restaurants stay in business. So I thought it was really cool that money that came locally, went locally, was spent locally, fed kids locally. It was just one of the best circles that you might see in providing for a community.
Everyone still really didn't know what to think, what to expect. We just knew there was this invisible threat out there called COVID. We really had to take all the necessary precautions. So we were in the parking lot and we were handing out laptops through car windows in sealed bags that had been sanitized. But that was truly a team effort that went across the division. Not just my technology team, but also the instructional side. We had teachers out there handing them out. We had custodians guiding traffic. We had transportation folks helping out. From the superintendent all the way through the division, everybody was out there at some point making sure that our students got the needed devices to be able to help them learn. And that, again, it was truly across the division. I'll never forget the teamwork that came together for that.
As scared as everyone was and is of this virus, they're more frightened to not help the kids. So the instructional technology that in the past they kept at arm's length for some because it wasn't natural to them, they knew it was the only way they were going to reach their students. So they let down their own guard and they embraced the change. Scared. We held a lot of hands. We were scared too, but it allowed us to keep moving forward. And when they would see the students respond in a positive way, it was like an energy boost.
I think, it's important to acknowledge that it's been a hard X number of months since March 2020, but I've seen a lot of willingness to try new things from students and from faculty and from staff. That level of ingenuity and creativity has made a big difference so far in students feeling comfortable reaching out and expressing what they need, and also knowing there's a variety of options that I can do to move forward from here.
One of the biggest changes was just taking a system that is very used to being the same all the time, day in and day out, and forcing it to become flexible. And I think the takeaway for us as local governments generally is that even those things that we sort of held as sacred lines that couldn't be crossed can be with the right level of ingenuity.
In local government, probably 85% of the workforce has to physically be there. We're a labor-intensive operation, whether it's, solid waste, utilities, fire and life safety. For the bulk of the workforce, the thing that impacted them, during the worst of the pandemic was kind of reconciling their personal safety with providing service, and basically attempting to apply common sense and not panicking every day. We were always chasing the rules that were changing before we could write our new policy.
The city of Williamsburg itself, we we have 207 employees. A lot of them have small children who were no longer in school, and we still need to, we're a public service agency. We need to help the public and the residents and businesses through this time. And so our Parks and Rec department stepped up and said, we will create a safe, 6 feet apart environment for the employees' children to come, first as a summer camp, and then transitioned into school. So that did a lot of things, but 2 main things it did was keep those Parks and Rec employees employed. And then our employees, who then could focus on the public, the citizens of Williamsburg, and their jobs because they knew their children were in a safe environment.
And the collaboration story is a really interesting one. So an internal example would be our Department of Community Services, where our closed senior center became a vaccination clinic. And the health department provided the vaccinators. York County Fire and Life Safety provided the standby unit in case somebody had an allergic reaction. But the community services staff, people that in normal times were running a senior center or running Parks and Rec programs, were basically providing all the logistical support. And so there you had a department that had nothing to do with their normal work was suddenly in the middle of it.
Where we spent a tremendous amount of time and effort in vaccinations, right? We particularly worked up throughout the Peninsula Health District and with other localities, set up 3 to 4 of these vaccination centers, but the one that we were most involved was collaboration between James City County, the City of Williamsburg, and York County. And I just can't talk enough about all the effort behind the scenes. We never had trouble putting staff there. We never had trouble getting volunteers. The hours they put in, if the clinic was going to run to 3 and they needed to stay to 6 to get the last vaccine used, they did. And they did that day after day after day. And I'm really pleased with our staff, the collaboration between the localities, the collaboration with the health department and the hospital systems. And I can tell you they were all doing things out on the edge of what they might normally do to be able to make that delivery. And I'm really proud. We delivered over 20,000 vaccinations over the time period that we were open, made a significant difference in James City County, Williamsburg, and York County in terms of our vaccination rates. So that, I think, is, of all the things, are the most crowning jewel for us in terms of accomplishments and collaboration.
We also saw a lot of people that were COVID positive, and the only way we could provide care was via telehealth. So to be able to do that and wrap around people short term and to think creatively, meet people outdoors, go for walks, find a discreet place you can talk to someone outside, socially distanced. It was amazing how people really rose to the occasion.
Telehealth has been an important instrument. We're still doing that, obviously for those with COVID cases, but other times it actually helps patients be able to have flexibility if they can't, get time off from work or childcare or whatever. So that's been a pretty good avenue to have as an option for patient visits.
All the patients, even young and old, like they seemed to really like to be able to just like message us, where before it would just been so many phone calls. So yeah, I think that's been another advantage to it. Like things are quicker paced, moving faster, using technology to our advantage.
There was one family in particular that I worked with, but it was the neatest thing. Grandma, who lived in Maryland, but was very involved, was at every single one of our Zoom visits. And that was just so neat. It gave me goosebumps to be able to understand the reach that we're able to have with telehealth, that family members from out of state are able to join in and parents aren't having to be the interpreters for their child or the interpreters or the relayers of information, because we can bring people from all over. We can bring dad from overseas or grandma from Maryland.
I was very proud of the staff that I was working with, because we may not have known the answers, but we came together, and from top down, from our county administrator all the way down, everybody truly worked together. And I think one of the best quotes that I heard during this time was, it was like flying an airplane while it was being built. And that's what it felt like. But people, even as they were worried about their own families, worried about keeping themselves safe, not spreading COVID-19, they still stayed very committed and dedicated.
Out of every disaster, which this was a disaster, it really was, bigger than any other natural disaster we've seen, you learn so much, and you learn so much about people. The sense of volunteerism in our community. I mean, we had people reaching out to us all the time wanting to provide assistance and do things and help. It was really great to see. You know, in times of trouble and during difficult times is when I think humanity really stands up and you see the good in people. And that was so encouraging and uplifting for so many. You know, those working at the vaccination centers and those frontline workers who had to continue to work, I think they really felt that. And that's really what kept them going through a lot of this.